Hey, it's the nursing professor here. I want to spend today talking about heart failure. Heart failure is one of the more common cardiac illnesses that patients actually experience. And in celebration of February, which is Heart Healthy Month, then let's just talk about it. We'll take 5 minutes of your time with this. All right, heart failure usually is broken into two parts. You can have either right or left-sided heart failure. Let's take left-sided first. Left-sided heart failure is the most common type. It occurs when the left side of the heart is weak and it can't pump blood, and usually the backup is in the lungs. So I always remember left side lungs. Right side is when blood backs up into the rest of the body, and so you typically would see those effects of that in the abdomen, which is called ascites, or in the lower extremity where you will see edema. All right. Now remember that systolic is when your heart is actually contracting, and diastolic is when your heart is supposed to relax. That becomes very important. All right, so some causes of it is coronary artery disease. We know about elevated cholesterol because literally it's like sludge lining those vessels. A heart attack where you can have a clot that cuts off circulation in the heart. High blood pressure, cardiomyopathy. Cardiomyopathy frequently results from people having poorly treated or untreated hypertension, because you're making the heart have to work that hard. And when the heart works hard, of course, it's going to build that muscle. You can have heart valve disease where those valves that sit in between, like open and close in between the ventricles and atrium, that they are not functioning as well, and you can get back up like that as well. And of course, arrhythmias, most common one is afibrillation, where you have this irregular heart rhythm that needs to be corrected because you're not getting efficient use of the blood being pumped around the body. All right, so some symptoms: you see the person having a difficult time, short of breath. Typically they have increased fatigue and weakness, swelling of their legs, ankles, and abdomen that we just talked about from that fluid backup. They can have rapid and irregular heartbeats like afibrillation. They can have decreased ability to exercise, and a persistent cough or wheezing, especially if they have left-sided heart failure. When that blood and fluid starts to back up in their lungs, you might hear wheezing. All right, treatment. How are we going to treat this thing? Diet, exercise, weight management, smoking cessation, and limiting alcohol. Those are lifestyle changes a person can make. And then we have multiple medications. So I'm just going to go through them quickly through classes. And I'm going to do a more detailed video on this because I think it's so important. Over on YouTube, I'll let you know in that post. All right, we have your ACE inhibitors. Those are the ones that end in pril, like your lisinopril, and they do help to relax the blood vessels and lower blood pressure. Same is true for ARBs, the angiotensin 2 receptor blockers. They are very similar to ACE inhibitors, but with a little less side effects. There's one thing you need to be familiar with ACE inhibitors, especially lisinopril. A person could take them forever, and then suddenly they'll have an allergic response where it's typically going to be angioedema, where they have all of the swelling in their lips, their throat, their tongue, and it is a medical emergency. Next, we have your beta blockers that slow down your heart rhythm, heart rate, also lowers blood pressure. You have your diuretics that's going to help eliminate some of that excess fluid. And you have your aldosterone antagonists that can also help with fluid management. Diuretics, of course, digoxin. Digoxin is an old-timey drug, but it works really well. One classic symptom of digoxin toxicity, and this is why levels are so important, is that a person will report visual disturbances like a blue halo, or they might have some nausea and vomiting. And vasodilators. Vasodilators work very well, but of course we want to caution our patient in particular when they're changing positions, because those vessels are opened and we don't want them to pass out. Other treatments include like pacemakers, ICDs, cardio conversion, heart valve surgery, heart transplants, and last but not least is a LVAD. LVAD is the left ventricular assistive device, and that's externally when a person really has no other options. And of course, there's palliative care where a person says, hey, I know I got this, but I want the best quality of life, and sometimes that is an option for them. So hopefully that helps. Bye for now.